Hello and welcome to this Foster Care Institute online training webinar, Mental Health Issues and Children in Foster Care. I am your host, Dr. John DeGarmo, founder and director of the Foster Care Institute. I am a best-selling author of several foster care books. I am an international speaker and trainer, and my wife and I have been foster parents to over 60 plus children that have come to our home and joined our family. Indeed, if you've read several of my books, then you know that in our home, there are no labels. There's no biological, there's no adoptive, there's no foster. They're all members of our family. They're all children that we love. Our goal during this webinar is to increase your awareness of the realities of the many, many issues of mental health that children in foster care face today. Not only will we increase your awareness of the issues of mental health and how it impacts all of our lives, but we're also going to give you some tips and some strategies and some understanding on how to best help and aid those children and families that are suffering in this mental health crisis. Indeed, it is a crisis. It is a crisis indeed. The real crisis that is facing our children today is that of mental health. We hear about it in the news. We read about it in articles. We see it on social media. Now let's look at some statistics surrounding mental health issues today in children. According to some studies, 80% of children in the foster care system have some sort of mental health challenge. Within the general population, though, children that come from and live in stable homes and those children coming from traditional families have about a 20% chance of having some sort of mental health challenge or mental health issue, if you will. So you can see that children in foster care face a far greater risk of developing a mental health challenge or issue. More statistics state that 44% of teenagers say that they felt sad or depressed since the lockdowns that were placed upon society in 2020 and 2021. Indeed, it was during those lockdowns that society placed upon us that more than 1/3 of students said they experienced some sort of racism since those lockdowns of 2020 and 2021. During those self-same lockdowns that were imposed upon society, suicide rates have jumped up considerably. Indeed, suicide attempts in young girls are up almost 70% since the lockdowns were put in place in 2020 and 2021. Now, it's important to keep this in mind. 5 million children in the United States of America experience domestic violence in their home every single year. Now, let's look at some definitions of mental health. According to the Center for Disease Control, also known as the CDC, mental health is this, quote, mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. Mental health is as important at every stage of life, from childhood and adolescence through adulthood. End quote. And again, we thank the Center for Disease Control for their definition. The Mayo Clinic says this about mental health. Quote, mental health conditions in children are most often defined as delays or changes in thinking, behaviors, social skills, or control over emotions. These problems distress children. Mental health conditions disrupt their being able to act well at home, in school, or in other social settings. End quote. And again, we thank the Mayo Clinic for this definition. So, what causes mental health issues, particularly for those children placed in the foster care system? Well, let's look at some of those issues and those challenges that children often face. As we've discussed here before at the Foster Care Institute, when a child is placed into a foster care environment, a foster care home, if you will, it is a time of great anxiety. You can put aside all of the abuse, all of the neglect, all of the trauma the child may have experienced before being placed in foster care. Being placed into a foster care setting is a time of anxiety. I want you to imagine a young child who suddenly, without any warning perhaps, is removed from her home. She's taken from her mother and her father, perhaps taken from siblings. She's taken from her bedroom, her pets, her toys, her stuffed animals, her house, her home. She's taken from her neighborhood. She's taken from her relatives, grandparents, aunts, uncles, cousins. She's taken from her school and her schoolmates and teachers. If she goes to church, from church, everything that she knows, everything that is familiar to her. Indeed, she is taken from all that is her norm. And she is placed into a foster care environment, a foster care home, perhaps your home, and told this is your new home, this is your new family. For some children, it's a time of tremendous uncertainty. Some might experience guilt because of it. They thinking that they are at fault, thinking that they did something wrong, thinking that their parents are mad or upset with them. And for some children, they are too overwhelmed with the emotions overflowing them that they're unable to express themselves. Again, this is a time of tremendous confusion and tremendous uncertainty and anxiety for these children. Indeed, children in foster care simply might not understand why they have been placed into another home. For some children, confusion abounds. They might see it as a very irrational or illogical move, one that does not make any sense whatsoever. They might blame themselves, thinking that they are at fault. Some children might feel that they are no longer loved. Other children might feel that they have been abandoned. Again, you can see how this is a time of tremendous anxiety for these children. The National Children's Traumatic Stress Network defines traumatic stress as the following. Quote, the physical and emotional responses of a child to events that threaten the life or physical integrity of the child or someone critically important to the child. So many children placed in the foster care system have experienced traumatic stress, which leads to mental health issues. What might be some of these traumatic experiences? Well, it might be prolonged separation of their family members. It might be death of a family member, various forms of abuse, whether it's physical, sexual, emotional, verbal abuse. They might witness of abuse of others in their home, perhaps abuse towards one of their siblings, perhaps abuse towards a parental figure. They might have experienced homelessness. They might have drugs or alcohol in the family. They may have been neglected or abandoned. Indeed, they may have had a family member imprisoned. These are all reasons why children might be placed into a foster care environment. And again, you can see how this can lead to their anxiety. Now, every time a child has been removed from one environment or one setting or one home and family to another home, to another setting, to another family, if you will, perhaps a foster care family, there are going to be changes. There's going to be disruptions, if you will, placement disruptions. These include emotional, social, psychological effects. Indeed, when a child is removed from one home and placed into another, there will be some sort of psychological or emotional, social effect. Their mental health could be threatened with multiple disruptions. Indeed, as we've seen here at the Foster Care Institute in several of our webinars and books, each time a child is removed from one home and placed into another home, and from home to home to home, well, their mental health is threatened with each disruption, with each new placement. And they have issues of trust and attachment as they go from home to home to home. As we've seen also here at the Foster Care Institute, children in foster care traditionally perform lower on their academic performances as well. Indeed, as they go from one home to the next and one school to the next, they fall further and further behind academically. Perhaps that is why children in foster care are, on average, 18 months behind academically than the student that comes from a traditional home. And they struggle with reading and math skills as well. Children who go from home to home often face anxiety, depression, post-traumatic stress disorder, otherwise known as PTSD, eating disorders, and as we mentioned earlier, issues of trust and issues of attachment. Now, for much more on the anxieties and disorders children in foster care might experience when being placed into a foster care environment, a foster care setting, foster care system, a foster care home. For much more, check out the webinar, Anxieties and Disorders, here at the Foster Care Institute. Indeed, I encourage you to watch that webinar when you're finished with this one. So we've seen some of the reasons why children in foster care might experience mental health issues. So what does it look like? What are some of the signs and some of the symptoms that go along with mental health issues? Well, children who are experiencing mental health issues face a number of symptoms. They might experience avoidance of things that might trigger or release their anxiety. They might be very, very restless, or they might be very tense. They might experience various forms of depression. They might have eating disorders and their diet might change. They might feel very, very nervous or tense or stressed, not only around you, but around everybody. They may have stomach aches or gastrointestinal problems. They may have a higher heart rate than expected at their age group. They might experience hyperventilation or breathing quickly. They might be very vigilant, over-vigilant, if you will, hypervigilance. What are some other signs and symptoms? Well, they may have mood swings. They might overdose on drugs and alcohol trying to escape their mental health issues. Those children who suffer from mental health issues often have prolonged sadness. And as we saw earlier, they often have school-related issues. These include behavioral issues, academic issues, social issues in school. Even more, those children who experience mental health issues may experience suicidal thoughts. And we have a webinar here at the Foster Care Institute on suicide, and I encourage you to check that one out as well. They might have extreme sweating or trouble sleeping, sleep anxieties. And quite simply, those children and youth in the foster care system who are experiencing mental health issues might be unable to control those worrying thoughts that they have. We mentioned post-traumatic stress disorder earlier. Post-traumatic stress disorder, or PTSD, is an anxiety disorder that occurs after someone has experienced or witnessed an extreme or traumatic event. The individual often feels very overwhelmed. They overwhelmed with fear, overwhelmed with terror, or they just might feel simply helpless. We have a webinar here at Post-Traumatic Stress Disorder at the Foster Care Institute, and I encourage you to watch that one as well so you can become more familiar with PTSD. Children in foster care who experience mental health issues might experience also feelings of avoidance. They might try to avoid any thought or any feeling or even type in conversation that's associated with a traumatic event that they experienced before being placed into the foster care system. They might avoid activities, activities that you might do as a family, activities you might do with a therapist or counselor. They might avoid activities or places or even people that might bring back or arouse those memories of a previous traumatic event. Those children who are experiencing trauma and mental health issues might have all loss of interest when it comes to activities in school, activities in your home, activities in other types of settings. Many times, children who suffer from mental health issues are detached or estranged from others. They might have a lack of loving feelings, and for many who suffer from mental health issues, they have a lack of a future, which means they do not see a future for them. Separation anxiety is something that many in the foster care system experience and suffer from. It's part of their mental health challenge. The more a child is moved from home to home and from school to school, and we noted earlier that's known as multiple displacement, the more they do so, the more their anxiety will increase. Separation from family, separation from friends creates this type of anxiety. Now, those children who undergo multiple displacements makes it very difficult for them to form any sort of healthy, positive relationship. A positive, healthy relationship with their peers in schools. They go from school to school, or teachers, or with adults in their life, perhaps with a therapist, a counselor, or a foster parent, or an adult figure in their life. And from those who are suffering from separation anxiety, many times they'll place emotional walls or emotional barriers between others to separate themselves from feeling or experiencing additional pain. Now, there are some barriers to treating children who suffer from mental health challenges. To begin with, as a child does go from home to home and family to family and placement to placement, they often don't get the professional therapy, the professional counseling, the services, support services they need to combat or to address their mental health challenge because they're going from place to place to place. And as they go from place to place in multiple displacements, they're again unable to get consistent and regular professional therapy and counseling and support services that they need. Those youth that age out of the foster care system often are unable to get ongoing professional help to help with their mental health, either before they age out or afterwards. Now, it's important to remember this. How each child reacts or responds to a mental health challenge is going to be very, very different. So, we've looked at some of the reasons why children in foster care experience mental health and what it looks like, the symptoms and signs, as well as the barriers to prevention. So, what is a diagnosis? How is a mental health diagnosed? To begin with, child's healthcare professional might suggest that your child placed in your home, see a mental health specialist. This specialist could be a psychiatrist, specialist could be a psychologist, the specialist could be a clinical social worker or a psychiatric nurse practitioner, or a specialist could be any other sort of mental health care professional. Now, these professionals, these specialists, will help to diagnose your child if they have a mental health challenge by doing the following. To begin with, they will do some sort of complete medical examination on the child. In addition, specialists will want to see a family history to see if there is a history of physical and mental health, not only for the child, perhaps for the adults, other siblings, and other relatives. They want to see if there is a history of physical and emotional trauma as well. Specialists will also want to see a medical history of the child, and they're going to conduct some mental health tests and questionnaires both for the child and, if possible, for the birth parents. They may also have questionnaires for the foster parents or perhaps caseworkers as well. Specialists will often review the symptoms and concerns with the foster parents, perhaps with the birth parents, perhaps with a caseworker. Specialists will also want to look at the school history of the child to see if the child has been falling behind, if there are behavioral issues, if there's been a history of anxiety or mental health within the school for the child. Specialists will want to sit down and talk with the child and observe and watch a child's behavior to see if they can see some of those signs and symptoms that are associated with mental health challenges. Of course, specialists will want to talk with the parents. Talk with the parents, the birth parents if possible, or talk with foster parents. Specialists will want to look at a timeline of how the child has matured over the years. Diagnosis also includes the following. Specialists will often diagnose mental health children, and when they do so, it's going to take time. It often takes time. Diagnosis is not something that happens very quickly or in one session. Young children, those children in their formative years, or perhaps in elementary school years, they have trouble knowing or saying how they feel. And how the child matures varies from one child to the next. So specialists will be looking at that as well. Indeed, a healthcare professional may change or even adjust the diagnosis, the mental health diagnosis, over time. We thank the Mayo Clinic for these examples of diagnosis. So, we know that mental health is a crisis in our society right now for our children. We know that children in foster care suffer from mental health much more so, at a greater rate statistically, than children coming from traditional homes. So how do we help these children? How do we help these children who are suffering from mental health challenges, from mental health issues, from this mental health crisis? Well, first and foremost, we can't take the child's behavior personally. If that child is experiencing mental health issues, we need to remind ourselves it has nothing to do with us. It has everything to do with a child and what the child has experienced, the trauma the child's experienced, the anxiety the child is overwhelmed with, the mental health issues that they face. Again, it has nothing to do with us as foster parents or caretakers. So anytime they may have any type of misbehavior, we need to remind ourselves not to take it personally. Instead, we need to look at why the child is suffering. Children who experience mental health issues need to have a sense of safety. Indeed, safety is a priority because these children need to feel safe. Remember, a child that's coming from a foster care environment from one to the next, multiple displacement, falls further and further behind in issues of trust and attachment, so they may not feel safe. They may not feel safe in your home. We need to remind them the child is safe. They might be triggered by noises, by nighttime, by darkness, or ways that we might not expect in our house, which can trigger their mental health. So safety is a priority. Remind the child that he is safe every single day. Let me say that again. Remind the child that's placed in your home every day that he is safe, that he's not going to be hurt in your home, that you will look after him, take care of him, and protect him. Consistency and routine are very, very key points in helping children who experience mental health issues. Indeed, the uncertainty about day-to-day schedules can lead to a great deal of stress or anxiety in a child's life, particularly for those children particularly for those children who have experienced neglect, abuse, trauma, abandonment before being placed into a foster care home. Remember, being placed into a foster care home is a time of anxiety. They're not used to your day-to-day schedules. They're not used to your routines. They're not used to your expectations. So it's critical that a child who's suffering from mental health issues has a routine, You need to maintain a routine as much as possible, a routine of getting up for school, breakfast, dinner time, playtime, bedtime, homework time, chores, etc. And in addition, you need to be very, very consistent with your house rules, your expectations, your routines, etc. For a child who is suffering from mental health issues, consistency and routine are key. Because then when they know what to expect in your home, when they know what time to wake up for school, when they know what to do when they come home from school regarding homework, dinner time, playtime, bedtime, etc., when they have this consistent routine, it takes away some of their uncertainty. It takes away some of their stress or anxiety because they know what to expect. They know what your routines are. They know what is expected of them. So again, provide that routine and do it consistently. To be sure, there may be times you need to be flexible in your routines, whether it's birthday parties, maybe a special night watching a movie, maybe a party, whatever it might be. Again, be consistent and have in place routine. Children who learn about mental health from their caretakers and adults in their life, which means children in foster care are learning about mental health from you and from the other adults in their life, whether it is a professional therapist, a counselor, a teacher, a caseworker. So it's important for all of us to model good mental health at all times in front of the children. To be sure, there may be times when you're quite simply not feeling the best. Maybe you are experiencing some stress. Maybe you have a little bit of anxiety, whether it's coming from the workforce, your own family, whatever, finances, whatever it might be. Even when you are not feeling the best, it is critical that you model good mental health in front of the children at all times. They're watching and listening to everything they say, that you say, and that you do. They're learning from you. You are their role model. Now, it is okay to share with a child that you might be struggling, that you might be having a difficult time. At the same time, it's also important that you share with the child what you are going to do about it in order to feel better. So when you are feeling a little bit down, when you are feeling exhausted, when you do have some anxiety or stress in your life, it's okay to let the child know that you're struggling with that. And you tell the child what you're going to do to feel better, to address your stress, to address your anxiety. We've seen here that children in foster care often experience issues of trust and attachment. For those children who have mental health issues, it's so very important that they form a healthy relationship, a positive relationship with at least one main caretaker, with at least one adult figure in their life. This is important if they're going to develop socially and if they're going to develop emotionally. So begin to build trust with a child by creating safe spaces in your home and in your family. Let the child know that they can come to you when they're struggling, when they have doubts, when they're filled with stress or anxiety. And when they do, it's important that you stop what you're doing and you listen. You don't question, you don't criticize, you don't belittle, you don't judge the child, you listen. This helps to build trust. Now, as we noted, every child needs to form a healthy relationship with at least one main caretaker or adult figure. This could be foster parents or caseworkers. It could be CASAs or mental health therapists. It could be juvenile judges or teachers or church members. Now, we know that when a child is placed into a foster care home, it is often a time of anxiety, which could trigger some mental health issues. So, how you help a child when he first arrives in your home is so very important to his mental health. Some things to consider when he arrives in your home. Don't forget, he will be filled with concerns and questions and uncertainty. So you can help some of his uncertainty, you can help some of his anxiety, you can help some of his mental health issues by having a welcome basket ready for him, asking if he's hungry and providing healthy snacks. Give him a tour of your home. Maybe the first few nights, cook his favorite food. Have some soothing music in the background. For much more on this, check out the book The Foster Parenting Manual, as we have a whole chapter devoted to welcoming a child in your home. Those children who suffer from mental health issues need to have reinforced healthy habits. As we know, many of these children coming to our homes, placed into a foster care home, are coming from an environment where there was no consistency, where there was no structure, and perhaps there were no healthy habits whatsoever. So for those children who have mental health issues, one of the ways you can help them is by ensuring and insisting that they get enough sleep every single night. It's important to remember that teenagers need more sleep as their body develops quicker than younger children. Eating regular nutritious meals with fresh fruits and vegetables, whole grains, and lean protein is something that's important for children who experience mental health issues. Indeed, limit their processed sugar, limit their junk food, limit their sodas and their caffeines. Those children who have mental health issues need to have exercise or play to help reduce some of their anxieties and stresses they face. Attend regular health care checkups on a regular basis and limit their screen time. Limit their screen time on any type of digital device, whether it is a phone, a laptop, a computer, a television. Limit their screen time. We mentioned earlier that when children in foster care are ready to speak, it's important that you listen. When they feel that they can trust you, when they feel they can come talk to you, it's important that you are there to listen. Do not overreact. Do not be critical. Instead, put down the phone, turn the computer off, stop the laundry, whatever you're doing, and sit and listen to the child. Nurture and comfort the child in an appropriate fashion, an appropriate manner. And as we said earlier, provide consistent structure every single day. For so many children placed in the foster care system, they've never had a word of encouragement or a word of praise. One way that you can help address their mental health issues is by encouraging them in a positive way, by praising them every single day. Indeed, children in foster care and all children, especially those children who are suffering from mental health issues, need to have words of encouragement. Remember, they may be suffering from depression. They need to hear that they are worthwhile, that they have value, that they're cared for. So find ways every single day to lift them up, to encourage them, and to praise them. Quite simply, you might be the first person who has ever said a kind word to them. You might be the first adult who's ever thanked them. You might be the first person who has given them praise for their work in school, for keeping their room clean, for helping with the kitchen and other home chores and responsibilities. You could be the first. Those words of encouragement and praise every day can go a long ways in helping to address mental health challenges in children who are suffering. Now, there are various forms of therapy that you can do within your own home. These include play therapy, music therapy, art therapy, and animal therapy. The book, The Foster Care Survival Guide, goes into great detail about these forms of therapy that you can do in your own home for those children who are suffering from mental health issues. Now, of course, you can do group therapy and group support as well. There's also forms of medication, and we'll touch on that coming up. One way you can help those children who are suffering from mental health issues is to be on the lookout and identify what might trigger them, what might trigger their anxiety and their trauma, and look for patterns. When you see that a child in your home is about to be triggered, so to speak, make sure that you are emotionally and physically available for them. Remind the child it's okay. Indeed, it is indeed normal to have these feelings, to have these anxieties. Let them know they're not alone. Let them know that they're not the only one. Let them know that these feelings are normal. Let them know that sometimes you experience similar feelings and anxieties. And be realistic. Be reasonable and realistic with your expectations. For those children who have mental health issues, therapy and treatments are not going to resolve the issues quickly. Same with unconditional love. Don't expect that simply loving the child is going to be the quick fix as well. When you're working with a child who has mental health issues, it's going to take time. And there are a number of things that you can do: professional therapy, professional counseling, routines, consistency, healthy food, enough sleep, praise, etc. Things we've mentioned here. These all take time. So it's important that you are reasonable and realistic with your expectations. Remember, the children in foster care are most likely behind academically, behind socially, filled with issues of trust and attachment. So this takes time for this child to trust, for this child to heal, for this child to have their issues of mental health addressed. Now, documentation is so important as a foster parent. It's important that you document any type of behavior that you believe may have been affected by mental health issues, and share this documentation with a caseworker, a professional counselor, anybody else who might be helping this child with mental health issues. Allow that child to be a child. Allow him to be a child. Encourage him to play. Encourage him to color and draw. Encourage him to use his imagination. Encourage him to go outside and be a child. And it's okay if he gets dirty doing it. Allow him to be a child. For so many children in the foster care system, they've never had the opportunity to be a child because perhaps they have been the adult figure for their siblings. They may have indeed been the adult figure in their own home. They may have been the caretaker for others in their home. They may have never had the opportunity to play, to be a child. One way you can help their mental health issues is by allowing them and encouraging them to play, to be a child. We mentioned medications earlier. Medications can be used to treat behavioral concerns. But the real work, though, the real healing, though, is done through various forms of therapy. Now, anytime you use any sort of medication, it's so very important that you consult with a doctor and the caseworker before you give the child any kind of medication. And of course, you document that fully as well. For much more on documentation, check out the book, the Foster Parent Documentation Book, which you can download right here at the Foster Care Institute, that has all the forms, files, logs, information that you need to properly document and to protect yourself from false accusations and false allegations. As we noted, professional counseling and therapy can be very important and quite critical to those children who are suffering from mental health. Whether it is individual or group or family counseling, again, these professional counseling and therapies are so important. So ask your caseworker if there's a professional therapist or counselor in the area that they could recommend. Ask others as well. Perhaps ask other foster parents in your area as well. One form of therapy is psychotherapy. Psychotherapy, also known as talk therapy or behavior therapy, involves talking with a psychologist or other mental health professionals. Now, with young children, psychotherapy might include playtime or might include games. During the psychotherapy, children and teens learn how to talk about and how to manage their thoughts and feelings. Child learns new behavior and coping skills. So you might want to talk to your professional therapist or counselor about psychotherapy. Indeed, ask your child's mental health counselor for advice on how to best respond, how to best address the child and his challenging behavior. In addition, you can enroll in parenting classes, parent training programs designed for parents of children with mental illnesses. A quick search online will show you if there are parenting training programs in your area. You can ask your professional health counselor or mental health counselor for the child. You can ask your caseworker or other foster parents as well. But indeed, training programs can go a long ways in helping you help the child who has a mental health issue. And finally, when working with a child, when living with a child, when caring for a child who has mental health challenges, it's important that you care for yourself. Because when you care for a child in your home with mental health challenges, it can be exhausting on so many levels. So practice self-care so you do not suffer from compassion fatigue. For much more on compassion fatigue, check out the webinar here at the Foster Care Institute on compassion fatigue. Now, if you're looking for some little words of encouragement yourself, some self-care words, check out the book, The Little Book of Foster Care Wisdom. You can find that book and several other books right here at the Foster Care Institute. Indeed, I'm sure there's a book right now that's perfect for what you're going through as a parent. For much more, visit our website, drjohndegarmofostercare.com, or quite simply, search for the Foster Care Institute for so much more on this topic and so much more. Follow me on Facebook and Twitter. Email me at drjohndegarmo@gmail.com. I want to thank you. Thank you so much for watching this webinar. Thank you, more importantly, for taking the time, for making the sacrifices needed to care for children in your home, to care for children who are in crisis. We are in the grip of a mental health crisis right now, and there are so few people who are willing to step up and say, I will help that child. I will help that child. You are doing that. You are making a difference in the child's life. You are a role model for others. You are an inspiration, encouragement for me. So thank you for all that you do to help children with mental health issues, to help children in foster care. For the Foster Care Institute, I'm Dr. John DeGarmo.